Hello everyone and welcome. Today we'll be discussing diabetic retinopathy and the impact it can have on a person's life. Before diving into that, it's important to first understand what diabetes is and how it affects the body. To start, let's take a look at a short video from Diabetes UK that explains the basics.
Two main types of diabetes, type 1 and type 2. They're different conditions, but they're both serious. There are some other rarer types of diabetes too. What all types of diabetes have in common is that they cause people to have too much glucose in their blood. But we all need some glucose. It's what gives us our energy. We get glucose when our bodies break down the carbohydrates that we eat or drink, and that glucose is released into our blood. We also need a hormone called insulin. It's made by our pancreas, and it's insulin that allows the glucose in our blood to enter our cells and fuel our bodies. If you don't have diabetes, your pancreas senses when glucose has entered your bloodstream and releases the right amount of insulin so the glucose can get into your cells. But if you have diabetes, this system doesn't work. When you've got type 1 diabetes, you can't make any insulin at all. If you've got type 2 diabetes, it's a bit different. The insulin you make either can't work effectively or you can't produce enough of it. In both types of diabetes, because glucose can't get into your cells, it begins to build up in your blood. And too much glucose in your blood causes a lot of different problems. To begin with, it leads to diabetes symptoms like having to wee a lot, being incredibly thirsty and feeling very tired. You may also lose weight, get infections like thrush, or suffer from slow-healing wounds. Over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, people can live a healthy life.
After watching this part of the video, let's go over a few questions to check our understanding and make sure that everyone is following along. Now that we have a better understanding of diabetes, let's focus on how it affects the eyes, particularly through a condition known as diabetic retinopathy. Most people know diabetes can affect blood sugar, but not everyone realizes it can also affect your eyes. Today we'll talk about a condition called diabetic retinopathy. It's one of the main causes of vision loss around the world, and it happens when high blood sugar slowly damages the small blood vessels in your retina. Diabetic retinopathy usually begins quietly, with no pain or clear warning signs. But as time passes, it can completely change the way you see and even lead to permanent vision loss if it's not detected early. If your vision slowly faded over time, how long do you think it would take before you actually noticed?
In the early stages of diabetic retinopathy, you might notice small floating dots, flashes of lights, or colors that don't look as bright as before. This happens when blood vessels in the retina start leaking tiny amounts of blood or fluid. As diabetic retinopathy advances, the eye attempts to grow new blood vessels to replace the damaged ones. However, these vessels are extremely delicate and tend to leak, causing further bleeding inside the eye. This can lead to greater blurriness and even scar tissues that distort or pull on the retina. That's why regular eye exams are so important. Waiting until your vision gets worse means it's already advanced.
The good news is diabetic retinopathy can often be treated or prevented when it's caught early. The first step is keeping blood sugar, blood pressure, and cholesterol under control. Regular eye exams can spot damage before it affects your vision. When diabetic retinopathy reaches advanced stages, doctors often use treatment like laser therapy or injections to prevent the growth of new abnormal blood vessels that can damage the retina. Still, the most effective way to protect your vision is through awareness and early detection before the condition gets that far. If you have diabetes, what daily habits would you change first to protect your eyesight? Did you notice how the title card got blurrier every time we mentioned diabetic retinopathy? That's exactly how vision fades, little by little, until you barely notice it all. So think back to our first question. Would you notice it on time?
That's exactly why awareness matters. Diabetic retinopathy isn't just a medical condition. It's a reminder that even small daily habits can protect something as precious as your sight. So to finish on a lighter note, our animated versions have a little message for you. Let's sing it out.
High blood sugar, tiny hoses break. Leaking, clogging, popping, that's the risk you take. Eyes are windows, fragile to see. Protect your vision, keep your numbers steady. Don't skip the eye exam, check it every year. Blood sugar pressure, keep those levels clear. Cholesterol down, no smoking your plan. Stay in control, yes you keep your numbers steady. Stay in control, yes you can.
And seriously, don't ghost your eye doctor.